It's Tanya Cooper Gavin. I'm 57 years old. I have two children, Lee, who's 40, and a daughter, Naya, who's 23. She'll be graduating from Pembroke State on May the 9th. I lost my husband in 2000 to stroke. And since then, I've worked with the hospital, and I've worked with Golden Living Center here in Lumberton. I've been doing CNA for 23 years. And I enjoy it. I like working with the elder people. In 2012, I did a mammogram. Big Spot Mall here in Lumberton was promoting breast cancer. So I did a mammogram, and it came back in maybe the first part of December of that year. And the people in Charlotte sent me, from the imaging center, sent me a paper telling me that they had found some abnormalities in my breast cancer testing. So I went to the Carolina Imaging Center in Fayetteville, where they did some more testing, and sent it here to the radiological center here in Lumberton. And I found out I had breast cancer. I had a biopsy done, PET scan, CT scan. Had quite a few different things done, and they all showed that I had breast cancer. And I had some abnormalities under my right arm that also had lymph nodes that had maybe about 5 or 6 that had breast cancer showing too. So in June of 2013, I had my right breast removed. And I also had 6 lymph nodes under my right arm removed. Before having that done, I went to the surgical center here in Lumberton, Robeson County. I went there and I met Dr. Crislow, who helped me with my diagnosis. She talked to me, which was very, that kind of helped me out a lot, because I really was scared, because I lost a sister to breast cancer in 2009. So I was really apprehensive about what was going to happen. Was I going to live? A lot of things went through my mind, and I wanted to be here for my children. They're grown, but they're still my children. I went to her, and she gave me a consult. And she assured me that it wasn't what it was, I say 10 years ago. The difficulties and the chemo won't as harsh, radiation won't where it burns you. She assured me of a lot of things. She didn't assure me of life, but she assured me that the procedure and the techniques were a lot more, I say, kinder to your body. We went through the procedure before I had it done. She came in and told me what to expect. She talked to my children. And that was the worst part of my my breast cancer experience, was having to tell my kids. It took me 2 months to tell them, and I told them the day before I had surgery, because I didn't know how to tell them. So when I went for my first consult, I took my children, and Dr. Crislow sat down, and she talked with them, and she talked with me and assured them, that it could be taken care of if we went ahead and did something about it then. And that was beneficial to all of us, because that kind of assured my kids. They were scared than I was, because of the fact that I had lost a sister. I don't know. The hard part for me was not losing my breast. I was okay, knowing that if I could be assured that I was still living without that breast, I was okay with that. That part never bothered me, the losing of my breast. I didn't really even think about that. My hair, I cut my hair before it came out, so that was fine. I'm not my hair, so I could do without that. My part was just preserving life and just still being above ground. That was really my thing. That was my most concern. What else can I tell you? My worst experience doing this whole ordeal of breast cancer was my chemo. It wasn't the doctors. It wasn't the treatment that they gave me. It was just not what I expected. It opens up something in your soul that I can't even begin to tell you about. It's just something that, it's like somebody sees something in the very core of your being. You understand what I'm saying? The very core is something that goes and touches that. And it's something that you don't, I don't want to say violated, but it's just, I don't know. It's just something I can't describe. Something I can't describe. But it touched that in my body. And after you get past the chemo, which after that first initial treatment, and I went through that, I was okay. I mostly slept. That was me. Healing for me was sleeping. That's the way I feel. Healing for me was sleeping. I slept a lot, I read a lot, and I just sat quietly. But healing for me, most of it involved sleeping. I really think so. My radiation, I sailed through it. I had no problems at all with radiation. My chemo was not bad. Don't let me fool nobody. It wasn't bad. It was just not what I expected. You know what I mean? But my radiation was okay. And as far as the whole experience of breast cancer, I think had it not been for the doctors and the people that surrounded me, as far as my medical team or whatever, it could have been a whole lot worse. But a lot of times I think what helps you is not just the medical part, it's got to be here. And that's mostly where it is. If your head can be in the same place your heart is, I think you can get past all that. And I just tell women, if you got breast, you need to go get checked. You really do. You really do.